Shaw, the Director of the Maine Center for Disease Control and Prevention. I'm delighted to be joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are here to provide an update on where we are with COVID-19 for the entire state of Maine for today, Wednesday, May 12th, 2021. Right now, across the state, there are a total of 64,749 cases of COVID-19, representing an increase of 302 cases. Sadly, just in the past 24 hours, we've received a report of an additional individual who's passed away with COVID. He was a man in his 80s from Cumberland County, and his passing brings the total number of deaths in Maine related to COVID-19 to now 798. We'd like to take a minute to offer his friends, family members, and community our deepest condolences. Cumulatively, 1,911 people have been hospitalized with COVID-19, and right now in Maine, 122 are currently in the hospital, 47 of whom are in the critical care unit, and 25 of whom are on a ventilator. Turning to testing, our 7-day PCR test positivity rate now stands at 2.19%, and our PCR testing volume is at 600 PCR tests that are being conducted for every 100,000 people in Maine. Turning next to vaccines and vaccinations. As of this morning, 58.5% of Mainers 16 and above have gotten at least their first dose of Moderna or Pfizer vaccine, or and as of this morning, 53.5%. Let me start that over. My apologies, everyone. As of this morning, 58.5% of Maine people over the age of 16 had gotten their first dose of vaccine, and 53.5% of Maine people have gotten all the shots they need. We are making great progress as a state. Indeed, not long ago, the Biden administration set a goal of furnishing 70% of all adults in the United States with at least their first dose of Pfizer or Moderna vaccine, or their sole dose by July 4th, 70% of adults by July 4th, per the Biden administration's goal. Right now, Maine, on that metric, is at 68%. Right now, it's May 12th, and the Biden administration wants the country to be there at 70% by the 4th of July. We as a state in Maine are already at 68%. But we've got more to do still, specifically for harder to reach parts of the state, where we know that access to vaccine can be still a challenge. To date, one of our core strategies to make vaccine access as easy as possible is to have partnered with FEMA on a mobile vaccination clinic that's visited different sites across the state. It's been in Oxford, Windham, Freiburg, Turner, today in Waterville. The clinic then goes back to Oxford and Windham for some second dose administrations before going to Old Town and Millbridge and points beyond. I'm pleased to announce today that in partnership with FEMA, we are extending the mission of the mobile vaccination clinic here in Maine. This clinic was originally slated to wrap up in mid-June, but again, in partnership with FEMA, we are extending the mission and thus the opportunity to be vaccinated at this mobile vaccine clinic until July 2nd. This 3-week extension beyond the 60-day approval will allow for new sites in places like Rangeley, Kittery, and Pittsfield. It will also allow us to return to York County, as well as to provide options for vaccinations in Rumford, all of which we know are geographically parts of the state where access to vaccine has been a challenge. We're pleased to be able to announce this extension of the mobile vaccination clinic and make vaccine the easy option for as many people in Maine. Now, this mobile vaccination clinic is offering Johnson & Johnson vaccine to those who are 18 and over, free of charge. One of the things that I've seen on social media recently and emails that we've received is folks asking if there's a charge for vaccines in general or at this mobile vaccination clinic. And the answer is no. To patients, there is no charge specifically at the mobile vaccination clinic. And walk-in appointments are welcome. I want to also take a moment to mention another mobile vaccination clinic that we opened last week. This is a clinic that we're operating in concert with our colleagues at ProAmerica Health. Right now, the clinic is in downtown Lewiston, in the municipal lot right in downtown Lewiston. This clinic too is offering Moderna vaccine to those 18 and over at no charge to the patients. This particular clinic is also offering early morning and evening hours to make vaccination the easy choice, particularly for working folks. Now, these two clinics are offering vaccine, for example, to those 18 and over because of the vaccine that they are providing. But what about folks who are younger than 18? What about younger Mainers? Well, as folks are aware, the US FDA recently authorized Pfizer's vaccine to be administered for adolescents between the ages of 12 and 15. Pfizer's vaccine was already authorized for 16 and 17-year-olds, but the recent move by the FDA extends the authorization down to adolescents aged 12 to 15. This is an important step forward in our work against COVID. I want to take a moment to explain why parents and those who are 12 to 15 themselves ought to get the Pfizer shot. Now, children are not as severely affected as are older adults when it comes to COVID. Even that notwithstanding, though, children, particularly adolescents, can and are affected nonetheless. Across the United States, if you take a look at all the COVID cases and zero in on just the age from 12 to 17, in that age category, there have been more than 1.5 million cases of COVID-19 in the 12 to 17-year-old group. More than 13,000 kids across the United States, aged 12 to 17, have been hospitalized because of COVID. And in recent weeks and months, according to the US CDC, as more adults are vaccinated, adolescents in this age category are making up a greater and greater proportion of total cases. As of April, 9% of the new cases reported across the country were among adolescents aged 12 to 17. Adolescents can also experience a rare but serious side effect of COVID called MIS-C, or multisystem inflammatory syndrome, in children. This is a severe condition that can arise in connection with COVID. Nationwide, there have been 3,742 cases of this condition, and 60 to 70% of those who are affected by it require a stay in the pediatric intensive care unit. And sadly, 1 to 2% of those with this condition, MIS-C, have died. So COVID can be serious and it can affect kids. But the other reason why kids should be vaccinated is that they can contribute to transmission in households and in communities. In particular, kids can transmit COVID, for example, to older people who they may live with in their household, people who may not be able to or have not yet been vaccinated. And so kids can contribute to infecting others. On the flip side, the vaccine that we have, the Pfizer vaccine, is incredibly safe and based on the clinical trials that were reviewed by the US FDA and today, as we are speaking, by the US CDC, the Pfizer vaccine is 100% effective at preventing COVID-19 among kids 12 to 15. That's why we recommend two things. We recommend that parents talk to their kids about getting the Pfizer vaccine. And critically, kids, I recommend you talk to your parents about getting the vaccine right now. We're working with existing sites, providers' offices, and schools to offer the Pfizer vaccine widely across the state of Maine. Given that COVID can affect kids and in some cases be serious, and given that we have a safe and remarkably effective vaccine, I urge every family to have the conversation about whether and when to get the Pfizer vaccine. Right now, the vaccines are our best ticket back to normal. One of the places that we are offering the Pfizer vaccine is directly in schools. And we're doing that in partnership with provider groups across the state. But there's one group of people who are really critical for making those vaccination clinics come together in schools. Indeed, it's a group that's been critical to keeping schools safe and open throughout COVID. And that is school nurses across the entire state. Today happens to be National School Nurse Day. And I'd like to take a second to thank school nurses across the state for all of the help that they have provided when it comes to COVID. It's hard, it's overwhelming, and there aren't enough of them in the state. But school nurses have been part of the reason why transmission rates of COVID have thankfully been lower than they are in schools compared to the entire community. And now, as we start offering Pfizer vaccine in schools, we have the school nurses to thank for helping put all the pieces together. So with that, I'm going to turn things over to our colleagues in the media. Commissioner Lambrou and I are happy to take any questions that they have. The first question for the afternoon goes to Brian Sullivan.
Thank you, Dr. Shaw. And I think that either you or Commissioner Lambrou could weigh in on this and talking about what you just mentioned with the schools. Can you explain a little bit the work that the CDC and DHHS is doing to coordinate these clinics, and I guess what you hope to achieve and maybe the opportunity? Is there a ticking clock, I guess, before these kids go away for the summer to get these things set up, and what you hope to achieve, I guess?
Commissioner, please.
I'll begin by saying, with the news about the 12 to 15-year-old authorization, we decided to just let all the clinics out there work with their school districts to see what they could do quickly, knowing that we're in that period of time where some of our larger throughput clinics are beginning to see a lessening of demand. So they could be able to redeploy staff to be able to help vaccinate these 12 to 15-year-olds. So we're trying to just get out of the way. We took away any sort of limitations on vaccine providers doing school-based clinics. We've been promoting those kind of relationships, and we're hoping that as many of those that could happen in the short run as possible. But we are going to work on a more systematic plan for June and July, recognizing we want to make sure that every youth in the state who wants to get a vaccine can not only get the first dose, but the second dose and be fully vaccinated by the time the fall school season begins, which in some parts of the state is mid-August. So round one is just pushing as many vaccine clinics to connect up with school districts as possible, encouraging these youth and their parents to go to a Walgreens, to look at our website. We'll start noting where those places are that can vaccinate these youth to make sure that they get the vaccines as soon as possible. But again, we'll go into a June and July phase working with our colleagues at the Department of Education and in the school districts to do a more systematic approach to make sure we're doing it equitably, to make sure that access is available for all.
Do you have a number as to how many kids fall into this category now? I'm sure that's on the CDC website, but just the ballpark figure.
Sure.
Yep.
It is 58,000 children in Maine or adolescents who are between the ages of 12 and 15, and then another 30,000 who are 16 or 17.
Thank you. And just a question about the latest you're hearing about boosters and and I guess the question I would have is the latest there. And if you start the process with, say, Pfizer and or Moderna, 9 months, a year from now, is any shot available, or do you stay the course with what you began with?
Yep, Brian, it really is too early to tell. In fact, just 2 days ago, I had the privilege of attending a meeting virtually, of course, with some of the principals and scientists at the US CDC to compare notes around how they are thinking around second doses or boosters. It really is too early to tell. And the reason it's too early to tell is that one of the things that might drive boosters or new vaccines is the emergence or the lack of control around variants. We've said metaphorically that we're in a race with the variants, but it's more than a metaphor. We are actually in a race with the variants. And if we don't win that race and do not outrun the variants, then the likelihood of new vaccines or boosters goes up that much more. But it's too early to really say, particularly around the question that you raised, which is, will it need to be the same vaccine or will there be a bit of a mix and match availability? Too early to tell.
Thank you both.
Let me turn to Amy Brown next.
Thanks, Dr. Shaw. Just to clarify, when you said 53.5% of Maine people have received at least one dose, is that encompassing the entire population or did you mean eligible people?
It's actually now with the eligibility being down to 12, the 53.5%, Amy, is actually just 16 and over.
Okay.
Hopefully in the next very, very soon, on the order of days, our website and our dashboard will be updated to reflect the 12-year-olds who are now newly eligible. We're down to the last hours and days to have that updated. So that should be very soon.
Okay, great. Thanks. Can you give an update on where things are with variants? I think it's been a week since the last one.
Sure. So right now in Maine, here's where we are with respect to the numbers of variants. For P1, there have been a total of 37 that have been identified. For the B1351, it's 3. For 117, it's 240. For 427, there have been 5 cases. And for 429, it's been 108 thus far.
Okay, great. Thanks. And just another real quick one, if you don't mind, how has the response been in terms of appointments being made and people coming to clinics for the younger people now that it's opened?
Yeah, I'm glad you asked. Based on what I've seen, and again, we're really encouraging walk-ins and such. So appointments that are made is not the only proxy, but the first 24 to 48 hours, the response has been strong. I've had reports from site operators saying that kids and their parents have been coming in, sometimes just to vaccinate the kid, in some instances to vaccinate the whole family, which is great too. So we've seen strong demand. We're hoping that we can do everything we can to make it as easy as possible for kids to get the Pfizer vaccine. For example, because the Pfizer vaccine comes in large trays of 1,170 doses, we've told providers across the state, if you only need 20 or 30 vials at a time, you let us know. We'll break it up and we'll send you just what you need so you can offer vaccine in your area.
Great. Thank you.
Thanks, Amy.
I will just add a quick reminder, though, that parental consent is required for people under the age of 18. So just as a reminder, make sure you check that out. And not every site does offer Pfizer. Dr. Shaw said this, but I just want to reiterate, do check before you go, because if a clinic only has the Johnson & Johnson, only has the Moderna vaccine dose, they won't be able to administer it to a youth. So it's a little bit different than adults. So we just urge parents and youth to make sure that they know those two things.
And one other note in connection with that, commercial pharmacies in Maine have been trusted and valued partners for us. Some commercial pharmacies will begin offering Pfizer vaccine starting tomorrow. And that's a function of which pharmacies are receiving Pfizer vaccine. But we understand that, for example, Walgreens, which has been receiving Pfizer vaccine, but others as well, Walmart, CVS, Hannaford's, et cetera, they will begin offering vaccine to this group of adolescents starting tomorrow. Let me turn to Patrick Whittle next.
Thank you very much. Just wanted to follow up first on an earlier question. So the Shopmobile has been extended to July 2nd. The mobile vaccination unit has been extended to July 2nd. but it's not able to serve children at the moment. Is it possible that it might be able to at some point? And failing that, are there going to be other kinds of options for sort of getting this to children other than things like school clinics?
Yep. So you're correct, Patrick. At this time, the mobile clinic is offering J&J, which is 18 and over. We don't have any current plans to shift the mobile clinic to the Pfizer vaccine, mainly because of the need to swing back by and give the second doses. So that's why we've been sticking with the 1-dose Pfizer regime. But in addition to the existing sites, hospitals, pharmacies, the school-based clinics, which we've talked about, the third group that we're working with are pediatricians and family doctors' offices. Indeed, according to some data that was presented at the CDC meeting just a few hours ago, for a lot of parents, that's their preferred spot to get the vaccine. So we're working with doctors' offices across the state. If they'd like to be offering the Pfizer vaccine, we'd like to be working with them to do that.
I see. Now, what follows is probably the most pressing question you'll get all month. There have been some concerns from readers of mine that laminating your card is a bad idea because it's possible that at some point it might be needed to document boosters. Now, the card that I got, the penmanship was such that they couldn't do that if they tried, but nonetheless, is it a bad idea to laminate? Because a lot of people have already done that.
You know, I don't want to weigh in on the laminate versus not laminate debate. I don't think you can make a bad decision there. If you laminate and you need to get a new card, it won't be too hard to just offer a second card or rewrite out the whole card. You don't laminate, you do have that option value, but this is a contentious subject. I'd rather not weigh in on it.
This is definitely it's definitely a hot button. And one final thing, there continues to be some concern about the difference between the EUA, the emergency use authorization, and full approval. I believe that Pfizer is getting closer to full approval and the others are not there yet. What would you say to people who have lingering concerns about this issue and what it means for safety?
Sure. You know, this is a good question. I've heard that from a lot of folks who have expressed concern that this is only an emergency authorization, not the full review. And there are two important points I want to make. You know, it is true that this was an emergency authorization, but none of the typical corners were cut. All of the data were reviewed scrupulously by the US FDA. The same public meetings were held to analyze those data. One of the things that differentiates the two is that the full approval requires a full 6 months of follow-up data, whereas the emergency use authorization didn't have that full 6 months on board. But if folks have already seen with the J&J vaccine, when it was paused, if there's a concerning signal, vaccine regulators in the United States are not afraid to say, let's just pause for a moment and see what's going on. I think that should reassure folks. But as you noted, Patrick, as Pfizer is now going through the process of getting the full authorization, Moderna has announced that it too will do that. What will change is just having that full 6 months of data on board. But those data thus far have been shown very good safety and very strong effectiveness.
Is it possible to ballpark when that 6 month point is? I believe the first of these might have rolled out sometime around Christmas.
You're right. So the way that they work is they work on a rolling submission basis. So once they've accrued a full tranche of 6 month safety data, they are eligible to apply for the full authorization. That's what Pfizer did last Friday. And then as more data become accrued, they continue to submit it to the FDA on a rolling basis.
Understood. Thank you so much.
Yep. Let me turn over to Emily at the Sun Journal next.
Hi, Dr. Shaw. I have a question about variants. So in Androscoggin County at Central Maine Medical Center, over the weekend, it looks like they had an all-time high number of inpatients in the ICU with confirmed COVID. And last week, they also had an all-time high of patients on ventilators. And I'm wondering if that has anything to do with variants or If you could speak to your theories about why hospitalizations and the intensity of those in the hospital seems to be increasing.
Sure, Emily. Something that our team has talked about, and you're right in general, many of the variants, including those that are circulating in Maine, are associated with higher hospitalization rates, as well as associated with making people sicker, thus the need for ventilation. I don't know if that's what was driving the increase in hospitalization rates in and around Androscoggin County. At the same time, Emily, in speaking with one of the executives at another hospital system in Maine to compare notes around hospitalizations, what they conveyed to me and our team was that a couple of things have been happening in their system. Over the past few months, the average age of folks who are hospitalized has fallen from being in the 60s now down to being in the mid 40s. The other thing that's happening is that people are being hospitalized for a longer period of time because they come into the hospital much sicker. Because they're younger, those who need to be hospitalized are very severely ill. The other thing that they shared was that in the preceding 3 weeks, for the people that needed to be hospitalized with confirmed COVID because of their COVID, in the preceding 3 weeks, all but one was unvaccinated. And the one person who was vaccinated had a number of other pre-existing medical conditions. Just think about that. In 3 weeks, at a major health system in Maine, younger people are now being hospitalized at higher rates, and almost all of them are unvaccinated. So what this is mainly a function of is folks not being vaccinated and not taking COVID seriously, and unfortunately getting sick and ending up in the ICU or on a ventilator.
And can you explain how exactly variants are tracked, and if hospitals would know of those who are hospitalized if they are positive for any of these variants?
So variants can be tracked in a number of different ways. We send a sample, a subset of all of the positive results that we get. We either sequence them in-house at our laboratory in Augusta, or we send them to the Jackson laboratories because of a partnership we have with them. And that's how we determine what is being sequenced. Hospitals themselves, though, could send a sample to us for sequencing if they wanted to, or it may be the case that if we had an inpatient that was chosen for our sample, we would then potentially send that back to the hospital to alert them. That doesn't happen routinely. Having a variant doesn't change the clinical course. It's an epidemiological finding, not a clinical finding.
Thank you. And I have one last question. The mobile clinic in Lewiston, do you have locations where it's going next?
Yep, we're working on the subsequent locations. We're probably going to head back to Oxford County. We've got a stop in Poland, and then we're also working with employers because many employers have requested that we come on site to them, again, to make vaccination the easy choice for workers. Let me turn to Chris Costa next.
Hey, Dr. Shah. Good to see you again. Wanted to quickly ask about getting supply of the Pfizer vaccine. I know that, as we've seen, as eligibility groups open up, we tend to have this issue with supply being less than what the demand is. Have you heard any indications from our federal partners or perhaps the manufacturers? Are they planning to increase the supply of Pfizer now that the adolescents are eligible to get it? And what will Maine CDC do in order to make sure we secure the doses for the people who want one?
Sure. A couple of things there. Commissioner Lambert and I have discussed this quite a bit. Right now, the supply of Pfizer in Maine, we believe, is quite robust. And so we're not anticipating shortages, but here's what we're doing to make sure we've got what we need on the Pfizer front. The first is our weekly allocation of Pfizer right now stands at about 21,000 first doses per week. Based on a call that I had with some of our federal colleagues yesterday, they are expecting some fluctuations in the Pfizer volume as the manufacturer wraps up its current contract with the US government and then looks toward another round of production. So that may dip just a bit. But what Maine has done is, pursuant to a White House policy change that was announced last week to allow states to share doses more easily, we've taken proactive steps in advance of, or in anticipation of, Pfizer being authorized for 12 to 15-year-olds. About a week ago, we reached out to other states that didn't immediately need their Pfizer vaccines and brought them into Maine. For example, from a VA system in another state that didn't need their Pfizer doses immediately, we went ahead proactively and brought those doses into Maine so that we didn't have any first day supply chain crunches in anticipation of the 12 to 15-year-olds. We are prepared to do that as needed to make sure, again, sites that would like to offer Pfizer vaccine can do so, and that we can supply them appropriately.
And just a quick follow-up to that. Do you know what the total number of doses you were able to get? I remember you talked about that federal pool program that you just mentioned. How many total doses were you able to get?
It was 4 trays of Pfizer, so that is 4,480 doses, 4,680 doses that we proactively, in anticipation of the authorization, last week secured from another location in another state, again, to make sure that we did not have any first day supply chain crunches. And that was 4 full trays of Pfizer.
Gotcha. Yeah, as I've been trying to track the data for several different metrics. One of them in particular is by county, by which you guys put on the dashboard. I'm starting to notice as I need to move up the thresholds in my data keeping to make sure that we're reflecting which counties are making progress. It appears that the ones that we've talked about historically in Western Maine, sort of the Androscoggin, Oxford, Franklin, Somerset general area, seem to be the ones that are continuing to kind of lag behind, especially in those final doses. Now that we're nearing kind of this 50% mark where many of the sort of the coastal, eastern and northern counties are kind of getting to at least 50% final doses, what is the plan for the Maine CDC to try to make sure that those other counties are able to reach those thresholds should the people there want to?
Chris, I'll start, and then Commissioner, please weigh in. Again, this is something the Commissioner and I have spoken about and planned around many times. Chris, I think we're at a good place to start, and in keeping with the theme for today, this is one reason we wanted to extend the mission of the mobile unit. So here are the sites that the mobile unit is going to. Of course, right now it's in Waterville. It's going to go to Old Town, and then Millbridge, and then Calais. It's going to swing up to the county after that. But for its extension, starting on June 9th, it'll be in Pittsfield, then Rumford, and then Rangeley. So we wanted to, part of the rationale behind the extension was to make sure that those sites, the counties that you noted, which we're concerned about too, had as much access as possible. And then we're also, again, working with providers, independent doctors, hospitals, pharmacies. Since we don't have the same supply constraints that we did previously, if they've got demand, we want to be able to satisfy it.
And that was part of the reason why the governor announced yesterday a new incentive program, the Shot to Get Outside program that would allow people who are adults, age 18 and older, who get their first shot of Pfizer or Moderna or a final dose of Johnson & Johnson beginning yesterday through Memorial Day to get a choice of a free fishing license, or if they're eligible, a free hunting license, entrance into any of our Maine state parks that are run by the state of Maine, or the Maine Wildlife Park, which has a great set of animals for those of you who have not visited it. People can also choose to go to a Sea Dogs game or Oxford Plains Speedway. These are the choices, but they're only available to people who have not yet gotten vaccinated, who are newly getting vaccinated between now and Memorial Day. The governor wants us all to take this preparation for summer seriously. We want to get all Mainers vaccinated so we really can begin to enjoy the summer the way we've done that in the past, and vaccination is key to that.
I gotta say, I was a little jealous as I laid on my couch with a fever and aches and I saw the incentives. I'm like, man, I missed out. Last question for you, Dr. Shah and Commissioner Lambrou. I'm sure you've been made aware there was some discussion between Senator Susan Collins and Dr. Walensky from the US CDC about some of the guidance that the CDC federally has issued. I think one of those has to do with outdoor transmission rates. Some of them have to do with summer camps and schools. Do you have any opinion on what the senator has said, what the federal CDC has said, just to add some context to all of this? And I guess more specifically, what do we know what the real outdoor transmission rates are for COVID-19?
I'll start there, and I won't weigh in or comment specifically on the exchange that the senator and the director had yesterday. I think what I took away from that is fundamentally outdoor transmission is really safe. And I think, we've learned a lot about COVID just in the recent weeks, months, certainly over the past year. And one of the most consistent findings amongst that has been the relative safety of outdoor settings versus indoor settings. The CDC initially benchmarked it as only 10% of the transmission occurring in out-of-door settings, but more recent research has really more consistently shown that it's anywhere from 1%, maybe even down to 0.1%. That should give us a lot of confidence as we, as the commissioner noted, are working to get folks outdoors. That's where the safety is. That's where we need to be on great sunny days to get back outside. That's really fundamentally what I took away from that exchange yesterday.
Yep, and as a reminder, Governor Mills did lift the requirement to wear masks when you're in an outdoor setting. That is already effective. On May 24th, we are lifting all capacity limits for outdoor gatherings or restaurants. It's going to 100%. And as we do approach President Biden's goal of 70% of adults having at least one vaccine dose, we'll be looking at our other protocols. We recognize that when people do the right thing and they get vaccinated and they protect themselves by wearing masks indoors, we might be able to continue to look at our protocols to allow for more engagement, more get-togethers, and more safe activity.
Thank you.
Thanks, Chris. Over to Jessica Piper next.
Thank you, Dr. Shaw. I wanted to follow up on hospitalizations. I know you said that it seems to be younger, unvaccinated people who are getting hospitalized more, but I was wondering if you could say more about, are there any parts of the state in particular that you're concerned about? And is the CDC keeping track specifically of exactly how many vaccinated people may have been admitted?
Jessica, in terms of parts of the state, what we've seen when we take a look at the hospitalization data is that it's across the state. As Emily noted, there have been recently at least higher hospitalization rates in Androscoggin County. That's eased somewhat, but we've also seen high hospitalization rates in rural counties. The reason, Jessica, that we have to be at least somewhat mindful as we look at those data is that very ill people may end up getting transferred to the tertiary care centers, particularly if they need intensive care or ventilation. So you may not be seeing the true risk emanating from a county based solely on hospitalization rates, because the really ill people are often transferred. And so the risk is all across the state, but what we've seen is that, again, it strongly continues right now to be correlated with folks who are not vaccinated and folks that really, had they been vaccinated, probably would not have ended up there. Now, in terms of tracking vaccination rates, again, we ask hospitals, and we've been working with hospitals as they have admissions of patients to try to get a sense of who's vaccinated, and that's where we get these data from.
All right. And I mean, obviously, having 130 people hospitalized on a given day is not something that we'd like to be seeing when we're at a point where there's more than 50% of Mainers who are vaccinated. Is this to some extent a new normal? Do you have any concerns about strain it puts on hospitals in the long term if we can't get these hospitalization rates down?
Commissioner Lambrew and I were better or closer to that discussion. Mm-hmm.
Yeah, so we have since last March met with hospital leaders on a very regular basis to take a finger on the pulse, see where they are, see what they need. Is it more PPE or testing supplies, more staff, more regional plans? We continue to do that to this day. The interesting part about our hospitalizations is, while we do have some concentration in central Maine, it is fairly dispersed otherwise. We really have seen not only the level of hospitalization not be really intense in 1 or 2 hospitals, but we've seen hospitals do a really good job of triaging. You know, if there's a patient who actually can be cared for at home, that patient stays at home. If there's a patient who could be cared for in a rural hospital without being transferred to one of our trauma centers with more intense staff, they're doing that. So we have learned over time how to manage this disease. We will continue to do what we're doing to make sure that there's no need for additional interventions like alternative care site to manage our patients. But I think to date, our hospital systems, our hospital CEOs, our home health and home care agencies that are supporting this effort have done a very good job of being able to both maintain regular hospital inpatient services while dealing with the surge of COVID-19 patients we've had in this past month.
Let me turn it over to Robbie Feinberg next.
Thanks, Dr. Shaw. Thanks, Commissioner Lambrou. Just wanted to ask about, with the new availability of vaccines for at least some students, those 12 and older, have there been any discussions at the state level about how that could influence states' requirements for schools for this fall? Like, could if there are certain vaccination numbers, could that mean that some of the requirements could be loosened? What's kind of being discussed right now?
You know, it's really early to say, Robbie. I mean, certainly theoretically, it's a notion, but what it would need to look like, what numbers we would need to achieve, it is really too early to tell. I mean, just as an epidemiological matter, vaccinations and availability in this age group are a step forward because we've seen cases, kids can be affected, they can transmit to others. So that's our primary focus right now, starting to think about what it may mean for the balance of the school year, but no final decisions on that. We're trying to take advantage of the unifying force that the academic year provides to get as many adolescents vaccinated before they disperse for the summer. That's really the focus right now.
Great. Thanks, Dr. Shaw.
Over to Megan at WMTW next.
Thank you for taking my question. I have a question about the vaccine as it relates to COVID long haulers. Some people who have had, long-lasting effects of the virus say that the vaccine has actually helped them recover and feel better. And I'm wondering about the science behind that, or from maybe the other standpoint, or conversely, would it be something that you would recommend as a treatment, maybe for a so-called long hauler?
Yep. So Megan, let's start with who should get the vaccine. And the bottom line is, if you, regardless of whether you've had COVID or if you're still suffering from residual symptoms of COVID, the US CDC recommends that you get the vaccine. I've read some of the same reports that you have, which is some folks who have been suffering from longer term symptoms of COVID, the so-called long COVID, have found relief after they got vaccinated. But Megan, as with so many scientific questions, what we really need is a proper randomized controlled trial to help us figure out the magnitude of that effect and what groups it has impact and which groups it might not have. Until we have those data, it's really difficult to understand what's going on, to the science point you mentioned, as well as to make any recommendations. I think the baseline recommendation, which is that folks should get the COVID vaccine, even if they've previously had COVID, that's the one that applies right now.
Okay, thank you.
And the final question for the afternoon goes to Joe Lawler.
Yes, hi, thank you. I was wondering about the scope of the school-based vaccine clinics. Do you think, I know it's just been a couple of days since the announcement, but do you think that most schools will be having school-based vaccine clinics? And I'm wondering about the logistics of it, how you overcome the logistics of the cold storage requirements for Pfizer and maybe some of these more far-flung districts.
Sure, Joe. Let me start with the latter one, probably building off the conversation that you and I and Tanya, our immunizations chief, had. That logistical concern, it's there. There's no question about it. But if I may, we've been planning for it. It's not a new concern. It's not something that we just uncovered. We have what are called cool cubes. They are cubes that can maintain, with the help of dry ice, they can maintain the Pfizer vaccine at the requisite temperature for enough period of time to administer it at a school, in a school gym, that sort of thing. And so it's a challenge, don't get me wrong, but it's a challenge that we can and have planned and prepared for. So we don't see that as a major logistical hurdle in bringing vaccine to schools, to kids. And as Commissioner Lambrou noted a moment ago, what we've indicated to vaccination groups across the state, be they hospitals, nurses, independent pharmacies, EMS, if they are approached by schools to host a clinic, please proceed, and then we'll work with them to get the vaccine. It's been happening across the state of Maine. I touched base yesterday, last night, or this morning with Director Cleaves down in York County, and they're hosting a number of clinics across York County. I know that in northern parts of the state, even up in Aroostook County, those are happening as well. We're hoping to do that as quickly as we can, again, to take advantage of the natural unifying force that the academic year provides to get kids their doses before they go for the summer.
Okay, and my final question is, I was hoping you could expand on something that you touched on about employers requesting on-site clinics for their workers. Can you give me a sense of how much that is happening and what the CDC does to make these clinics happen? Is this something we could see proliferate over the next few weeks and months?
We hope so. We really hope so. And Commissioner, I'll turn it over to you on that.
Sure. And so a lot of what we do is, as I said earlier, getting out of the way. So we have been, promoting clinics, working with employers. I know that PCHC in Bangor has been working with different employers who have potentially vulnerable workers, working conditions where it's harder for them to keep apart to get vaccinated. As you'll see on our route map for the mobile vaccine unit going forward, we are purposefully trying to position that mobile unit near large employers in different areas like Chimbro and Pittsfield. We also are likely going to be doing something more systematic with the hospitality industry as new workers come to the state of Maine for the summer season, trying to identify vaccine providers who are willing to go on site or to a site proximate to a whole bunch of restaurants or hotels and hold clinics at those shift changes, maybe 3 to 5 o'clock in the afternoon, or maybe 9 to 10:30 at night, in an effort to try to get to people as they're coming and going from work. So we were going to take a more active role, I think, in that type of facilitation going forward, as we're doing that stretch, trying to get to that remaining population who, again, may not be the ones who are first in line to get a vaccine dose, but may want it and may need that convenient access proximate to their work site to do so.
And Joe, I know your question focused on workplaces, and we're focused on that too, but not only focused on that. We've been working with faith leaders to offer or recommend vaccination opportunities in their respective houses of worship. We're looking at other groups where people may be coming together. Maybe it's a social club. Maybe it's any instance where there might be folks who are there, present, and wish to get vaccinated. We want to try to facilitate or get out of the way and allow those connections to happen. So thanks a lot, Joe. And thanks to all the questions this afternoon. Commissioner, I'm going to turn it over back to you to close us out.
Dr. Shaw. So as we approach, these high numbers of people vaccinated, there are, again, pockets of people who are either struggling to get a vaccine appointment. Maybe they don't have transportation. Maybe they don't know how to do this online. We do remind people that we have our 1-800 number as a service for everybody who needs a vaccine. We want to make sure that if you have questions, you want to know more about where you can get a vaccine, you need a ride, you can call 1-888-445-4111 to find out this information, or go visit our state website. We really think that there should be no barriers if we can help it. It's free. We can get you there. We can find a place that has the type of vaccine that you want, and hopefully we can help you get that shot as soon as possible. And again, if you do it before Memorial Day, you too could be one of those people who gets a $20 gift card to El Bean, or gets a chance to do something like get a fishing license that you never were able to do before. So we really do urge people to take this opportunity to get ready for summer, to help Maine get back to normal, which we can do in these coming weeks with some more vaccination.
Great. Thank you, Commissioner Lambrou. Thanks everyone for tuning in this afternoon. We look forward to catching up with everyone soon. In the meantime, as always, please be kind and take care of one another. See everyone soon.